Don't frown, smile. Lenticule tear management simplified. The authors have no relevant financial interests to declare.
So Relax Smile is a new technique where you first dissect out the two planes, the anterior and the posterior. So the anterior plane can be dissected in the manner that is shown in the video, followed by the dissection of the posterior plane. And then the lenticule is pulled out. So, no excimer, laser or tissue ablation is done. It is a different procedure to conventional LASIK. It's safe, it's repeatable and it's predictable. However, like any new technique, it has new challenges. So it starts the femtosecond laser by the lenticule cut, followed by the lenticule side cut, followed by the flap cut, and then finally by the flap side cut. So here's one case where after laser you found a lot of dark spots. Now these dark spots can pose a problem because incomplete tissue dissection can be there. Using the point dissector, the anterior plane and the posterior plane was found out, followed by the dissection of the anterior plane. A bit of resistance was encountered because of the presence of dark spots. However, the anterior plane was dissected completely. While dissecting the posterior plane, some resistance was encountered. Now when you do encounter resistance such as this, you should first dissect the area of resistance. However, in such a case, I had dissected the area which is with least resistance. Making the dissection of the resistance area difficult because the fulcrum of attachment is lost. A part of the lenticule was torn, and using a forceps, using the peeling technique like you do in case of CCC, the lenticule was trying to dissect out. However, a part of the lenticule was torn. So the approach was to go via a sharp dissector. However, sudden movement from the patient resulted in the side cut getting extended. Then the dissection of the posterior plane was continued using a sharp dissector. It was a very slow process. One has to be very persistent and patient while doing such a scenario. Then again, using forceps, lenticule was tried to peel off using a forceps like you would do in a continuous curvilinear capsulorhexis in the case of cataract. Finally, the remaining lenticule was taken out. Now comes the nervous part. The lenticule was put onto the cornea, and the first torn lenticule was then again put on the cornea to check for apposition whether any lenticular fragments were left behind. We were lucky that it was nicely apposed with a perfect fit, and therefore no lenticular fragments were left behind. The interface was irrigated, and finally ironing was done. and a bandage contact lens was placed over here. So post-operatively, the patient had an uncorrected visual acuity of 20/60 on day 1, 20/30 on day 7 and 20/20 on day 21. So the take-home message is, SMILE is a new technique with little learning curve. However, complications may occur like any other surgery. Therefore, careful planning is important and innovative methods of management are required to handle such difficult scenarios.
Remember that dark spots indicate sites of incomplete femto dissection, so be careful, be alarmed when this sort of a situation arises. Also, always it is important to match the lenticules and make sure that no lenticular fragments are left behind. Thank you.